All right, it is 9:32. I'm going to go ahead and get started. I want to thank everyone for being here and welcome to the Strong Center for Developmental Disabilities, known in this project as the Rochester Regional Support Center, or RSC, LHD Networking Meeting, or Local Health Department Networking Meeting. Thank you again for joining us and listening to those who are listening to the recording afterwards. I want to thank you first and foremost for all your work in the communities during this pandemic. I know things have been crazy and it's tremendous work to be tacking on to such an evolving and novel global episode and on top of your already full workload. So we do appreciate that you're here and taking the time with us to go over this information. So a few housekeeping items to keep it brief. We ask that you please share your video if you're able to. I know it's early and we are on Zoom, but it's always nice to just feel a little bit closer to humans when we have to sit in front of a computer screen. If you have any questions as we go through the presentation, please do your best to wait until the Q&A sections. We have two of them kind of sparse out during the presentation. But if you do have something that you want immediately addressed, please feel free to use the chat and we'll get to it as quickly as we can. If you have any technical issues, my colleague here, Mark Williams, is on the call. Feel free to reach out to him directly in the chat or send him a quick email, mark_williams@urmsd.rochester.edu. Thanks, Mark. Sorry to throw you on the spot there. All right, and for a quick overview of the agenda, we'll start with brief introductions, and from there we'll run through the RSC process and the progress we've made so far. From there, I'll give you a brief overview of the feedback we've received so far from families, and my wonderful colleagues who are family specialists from Einstein in New York City are going to explain a little bit further about the findings as well. That will bring us to our first Q&A. We'll be happy to answer any questions that you may have at that point. Wendy Douglas is here from Chautauqua, and she has graciously agreed to give us an introduction to a community initiative that's in its pilot stage. I don't want to give any more information than that because I'm really excited for her to present. And after that, we'll have a quick Q&A for Wendy so that you can ask her some questions about what's going on. So for brief introductions, again, I'm Mark Prinz. I'm here at the Strong Center for Developmental Disabilities, also known as the Rochester RSC. My role here is as community liaison, which means I interact with you, the local health departments directly, work on the technical assistance for this project, and kind of by circumstance as well, we're in transition right here at Rochester with our family specialists, so I also have been included in on some of those family sessions. So again, I'll be there for the Q&A about any questions you may have in case I have anything from the sessions I was able to participate in. I'm going to start out with my team here at Rochester. Sabrina, if you'd be willing to introduce yourself and tell your role.
Hi, I'm Sabrina Smith. I'm the project manager for the Rochester Regional Support Center for Children and Youth with Special Healthcare Needs. Welcome, everyone.
I think we have Mark Williams, obviously, is here.
Hi, I'm Mark Williams. I'm technical support for the project, IT-related and web-related questions. If you have any problems with any side of the technical side of this, please feel free to contact me. Thanks.
And then it looks like we also have Terry Welsh here from our team. Terry? Oh, muted. Nope, still muted.
I was about to say it's usually the opposite. I have it open when it shouldn't be open. Good morning. I'm Terry Welch, and I'm the materials specialist at our site. And welcome to everyone.
And as I mentioned, we have Einstein here from New York City. I'm going to let Rachel introduce herself.
Good morning, everyone. My name is Rachel Passmore. I'm the project manager at the Einstein Montefiore Regional Support Center. We are located in the Bronx, New York, and we serve New York City, including Bronx, Brooklyn, Queens, Manhattan, Staten Island, as well as Nassau County and Suffolk County and Long Island. And we're really excited to support our partners at Rochester today. I'm going to let the rest of my team introduce themselves, so I will pass it off to Marcel.
Thank you, Rachel. Good morning. My name is Marcel Pachtard. I am a bilingual English-Spanish family specialist for the children and youth with the Special Healthcare Needs Project at the Einstein Montefiore USET. I'm glad to join this meeting and thank you, everyone.
Okay, Miriam, do you want to go next? Thanks.
Good morning, everyone. My name is Miriam Frankel, and I am a family specialist with the Einstein Montefiore Regional Support Center. Thank you.
Great. And Shaniqua?
Good morning. My name is Shaniqua McKenzie. I am the project's administrator, and welcome everyone.
Thanks so much. And I think that's all of our team here today. Back to you, Mark.
Perfect, thank you. And I'd like to highlight, I think you all have heard this before, but our family specialists are in their roles specifically because they do have children and youth themselves with special healthcare needs. So I want to appreciate the value that they bring to that role and being able to engage families kind of on their level and really understanding when they have these sessions, kind of where these parents and where these individuals are coming from. Our colleagues at the State Department of Health, it looks like we have a few of you online. If you'd be willing to just give us your name and your role. I'm sure most people know who you are though. Start with Sue, putting you on the spot. You got this.
Okay, how's that?
There we go.
Okay. Morning, everybody. Sue Swan from DOH. I'm the director of the Bureau of Child Health that this program is housed in. Welcome.
It looks like we've got Natalie DeLong on. Would you be able to say hi, Natalie?
Hi, good morning. I'm Natalie DeLong with the New York State Department of Health. I work with Sue and I work alongside the RSCs. Good to be here. Thank you.
Absolutely. And then we've got, it looks like Mari is here as well. And we also have Christina. All right. So I'm going to actually have the local health departments now. If you're willing to just say your name and what county that you're here from, that would be great. Whoever wants to go first.
Hi, this is Susan Lewis. I'm here with Karen Bergren, and we're with Madison County.
It's Faye Plustic with Jefferson County.
Megan Walker, Schuyler County.
Wendy Douglas, Chautauqua.
Janice Janoshek from Niagara County.
Denise Nichols, Chautauqua County.
Debbie Krenzer-Luter from Genesee and Orleans County.
Here's D. Coolman, Seneca County.
Hi, Lori Fisher from Cayuga County.
All right. If there's anybody else, we're just going to cut it off there, but thank you for being here. I got a message from Christina. It looks like we had some issues with unmuting her computer, and sorry, Christina, she's still there. Glad to hear from you. I pulled up this screen so that we can have just a brief sort of visual of what area of the state that we're talking about today, since Rochester's catchment area is the full western side of the state up until kind of that middle divide line. So as we're talking about findings and you know, the information we've received is from these highlighted counties. So next we're going to talk really quickly about the process and progress of the RSCs for the Children and Youth with Special Healthcare Need project. So as you know, we have three main objectives. One of those is to provide technical assistance to you, the local health departments. We're going to go over that a little bit more in detail. Additionally, we are collecting and maintaining a comprehensive statewide resource directory, which is in progress, and we'll have more updates for that as well. We're hoping to do something that is online and gives you a searchable feature. We also have been working pretty tirelessly to engage families of children and youth with special healthcare needs. And again, thank you to my colleagues who are going to talk a little bit more to that in later slides. So the big question is, what is technical assistance? Well, it's defined as providing support to an organization on a specific issue. And for this project, the DOH has prioritized family engagement and optimizing both the presence and connection with families in their local communities. Our process to achieve that goal is to first have you, the local health departments, complete a needs assessment for us here at the RSCs. Then we're going to do a follow-up call with you where we have a brief interview just going over the questions since they're pretty standardized. We want to make sure we get into those details with you. From those details, we'll have an initial phone call where we'll pull together a technical assistance plan, and we'll start setting goals for ourselves that are realistic based on what your needs are, as well as kind of the room that we have to maintain or to achieve those goals. And after we've started that initial plan, we'll then have regular follow-ups together as RSCs and LHDs. So just to give you a quick overview of what we've achieved so far. So a total of 60, I think it might be 62, though 2 of the counties might not be participating. So out of those 60 altogether, we've collected about 34 needs assessments, 15 here at the Rochester site. And we recognize that during COVID, there's a lot going on. So we just wanted this to be kind of a number to highlight where we're at. This is not a negative or a positive. This is just where we are. In addition to those 15 needs assessments that we've received, we've done 3 follow-ups so far. And I do have to admit those were in the summertime or even earlier in the summertime. So I'm sure we'll be doing another follow-up with you to make sure that we're back on track for year 2. So now for examples of TA, I'm going to actually turn this over to my colleague Rachel from Einstein and let her talk a little bit more.
Hi, everyone. Again, my name is Rachel Passmore, and I'm the project manager at the Einstein Regional Support Center. And I'm going to talk about examples of technical assistance. Just a reminder, even though I'm talking about technical assistance, your go-to contact for technical assistance is Mark Prinz. The Einstein Regional Support Center is designated as the coordination, you said, so I kind of coordinate all emails that go out to all New York State local health departments. Oops, sorry about that. So if you get an email from me to that Einstein Children and Youth with Special Healthcare Needs Project LHD listserv, that is because I have information that applies to all 62 counties across New York State. And so hopefully you've found those emails useful. If you haven't, you can let me know and we can try to improve it. We could remove you. Anything you want to say, we're happy for feedback. And you should be able to respond to that listserv now. So if you have information that applies to all 62 counties across New York State, feel free to share it. We really want to create a safe space where we can share information that benefits all families across the state. So moving on from that, examples of technical assistance, share training opportunities and share resources. That's what the listserv is for. And I'm sure Mark has been in touch with you about more localized resources and training opportunities. And we will continue to do that through the remainder of the project. We offer suggestions and recommendations to overcome barriers and challenges encountered. And again, that comes from the needs assessment where we hear your barriers and challenges and we try to work with you to overcome those. We connect LHDs with similar family engagement goals to each other and coordinate calls between them. And I know Mark has been working on pairing LHDs that have succeeded in one area and maybe struggling in another to kind of help each other out. And I'm sure that's coming for you all. Coordinate calls with stakeholders of interest. So for example, we'll go to the next slide where, just one second, Mark, actually, sorry, all over the place, if you don't mind going back. An example of technical assistance that the Einstein Regional Support Center had was we had our digital marketing director from Einstein give a presentation to our 3 local health departments. So that's New York City, Suffolk, and Nassau. He talked about boosting the impact of local health departments through social media. It was well received, and I sent it these slides and YouTube recording to all New York State and local health departments. So that's an example of technical assistance that each RSC could give to their LHDs, and Mark could do something similar for you all if that's, you know, of interest. So now going back to coordinating calls with stakeholders of interest, we'll move forward with that. If you go to the next slide. So regional resource guides is a way we can support you all. We are working on these throughout the project, compiling and updating regional resource guides and sharing that information with multiple systems navigator. If you haven't heard of that or used that before, they might have information that is helpful to your families, and I'm sure you will get a PDF copy of these slides afterwards. You can click on the link and get to multiple systems navigator. Same with Health Data NY. That's where our information will eventually go. So keep your eyes out on that for 2021. And yes, we want to have information that's localized and useful to you. So we're dividing it up by regional catchment areas. If you want to go to the next slide, Mark. So going back to stakeholders of interest, sorry if this is all over the place and unclear, feel free to let me know and I can clarify in the Q&A section. Host webinars for LHDs, that's one of our goals. And this is how we connect you with stakeholders of interest. So in September, the Einstein RSC held 2 webinars that were available to all local health departments across the state. One where we connected strategies for connecting with families during COVID-19, which featured include New York City. And that organization now has webinars and trainings that are available to all counties across New York State. The second one is was about family professional partnerships with Parent to Parent of New York State. And we hope you're able to attend, and if not, when you get the copy of the slides, you can click on the links and you can watch the recordings there. So the next webinar we will hold before December 31st, 2020 is featuring NAMI of New York State, and that will be about mental health conditions. So hopefully these webinars are useful to you and we can connect you with stakeholders across New York State that help you with your work. And of course, we always send out a survey after each webinar to make sure we hear your thoughts about it and to improve future webinars. So I think that covers the technical assistance activities portion. Mark, if there's anything I misspoke about, feel free to clear it up and I'll pass it back to you.
I think you're good. And as Rachel said, we are always here for feedback. So if you have any questions, concerns, feel free to reach out to either of us directly. Rachel's information was in that slide 2 ahead, and I've got mine at the very end. And at this point, you all should have it as well. So let's go on. So I'm going to go quickly, or not quickly, I'm going to start going into the findings currently that we have from our family and individual sessions. Like I said, we've been engaging families and individuals with special healthcare needs. And this is kind of what we've found so far. And again, I want a caveat of this is, you know, after year 1 of the project, we're still going to be collecting more information. We do not have all counties represented yet, but I will show you that in the next slide. So here is an overview of kind of who is represented so far in our family groups. We've had a total of 64 participants. I believe it was 5 of those sessions were group sessions and the rest were individual. And so far, the largest number have come out of Monroe County. I want to recognize that, again, with COVID being involved, we started doing our family sessions back in April or May, which limited us very much on how we were recruiting. So a lot of our individuals are from Monroe County, but we did thankfully have some connections out in our other counties from earlier in the year, and we were able to pull some other individuals, both from the visits that myself and our family specialist, Melissa Parrish, were able to make at the beginning of the year. And we also had some organizations that were willing to send out recruitment information that allowed us to get a few more from our counties that are a little bit further away. So like I said, we're gonna really focus on, in year 2, making sure that the counties that are not currently represented will have individuals that have given us feedback. So that way we can make sure we're, you know, encompassing our entire state when we get this feedback. So here's a quick back to the visual representation of which counties have been represented so far. And again, we're going to look at that North Country, St. Lawrence, Jefferson, Lewis, Oswego, Oneida, Madison. That is going to be our primary target for this coming year. Here's a quick representation of what conditions have been represented so far in the family and individual discussions. As you can see, our largest proportion has come from ASD, as well as kind of the overarching developmental delay. ADD and ADHD came in at 3rd, as well as other mental health conditions. One thing that's been kind of interesting from these family sessions is there's definitely been an impact on mental health, and I'm sure you all are aware of this, during COVID. And as we've progressed this year, you can hear it more poignantly kind of addressed each time we have these groups or individual sessions. My strong belief is some of these conditions are cropping up specifically because of COVID. We're hearing more about anxiety and depression in the children. So I'm guessing that that's part of it. The other section, I wanted to note that very quickly, between genetic or inherited conditions and intellectual disability. A large portion of that actually came from an FASD group that we held, so fetal alcohol syndrome. And that actually was a very fruitful group. So one of the things that we asked during our sessions, and I wanted to present to you, we asked parents and self-advocates to indicate of the following, which 3 areas they or their family could use support in right now. And again, we're part of this is in the context of COVID, and part of this is in the context of pre-COVID. So the answers that we got were kind of mixed, but I wanted to kind of give you what we found so far with that caveat. And this is where I'd like to thank my colleagues from Einstein, Miriam, Shaniqua, and Marcel. They're going to assist me a little bit further in explaining what these different concerns are and what they heard from families. So we gave them the option of ordering the primary concern for them, the secondary concern for them, and the tertiary concern. One of my favorite words is tertiary. And this is what we found. So out of the primary concerns, the number 1 was emotional and social supports. I doubt any of us are very surprised by this. In addition to 2nd and 3rd were access to medical care, as well as access to childcare. And then the 4th one on the list was assistance from the school system. For the secondary, we found community integration came in at number 1, followed hot by emotional and social supports, again, access to medical care, and assistance from the school system. And then the tertiary concerns, emotional and supports again, assistance from the school system, community integration, and transition to adult services. So from these 3, from the primary, secondary, and tertiary, the responses, we've come up with the top 3 that we found. I want to give another caveat that, you know, we saw access to medical care and access to childcare were in the top 4 as a primary. We want to make sure that we address that fully. So we're actually going to have more educational materials at a later date, both for parents and for local health departments. And we'll look into having another sort of engagement around those topics. So I'm gonna push those off to the side for now. And I'm gonna move on just right into social and emotional support. And Miriam, if you'd be willing to present.
Good morning, everyone. Again, my name is Miriam Franco, and I am from the Einstein Montefiore Regional Support Center, and I am as a family specialist role. So social and emotional support. This was one of the themes that consistently came up in our discussions with families. And we wanted to define it a little bit. So social emotional support helps in the process of developing and using social and emotional skills. It is the skill set we use to cope with feelings, set goals, make decisions, and have good relationships with and feel empathy for others. Some of the things that family expressed in our session were difficulties with obtaining mental and emotional health services for their child and youth. As Mark mentioned, this was more in the current climate that we have with COVID now. Families were expressing difficulties since schools were closed and remote learning went on and some services were canceled. You know, we saw a lot more of difficulties in accessing these services. Finding support for financial challenges was another one that was mentioned a lot. Supporting navigating systems of care for services and support, limitations in the workplace to be flexible to care for a child. Some parents expressed that they passed on promotions to be able to be flexible to care for their child and to be able to provide, you know, support and services for them. Examples of existing supports. Some examples are support groups that are specific to conditions or diseases, or support to all families and children with special health care needs. Support from extended families. Examples are grandparents, sisters, or friends to care for the child or youth. Organizations that offer parent training, family reimbursement, and alleviative care for a child or youth with special health care needs. Some parents suggested access to more support systems for siblings and parents to cope with having a sibling or child with disabilities. If you can see on the screen here, there's a quote here that says, I would say probably family is like our main support system, but a speech therapist is definitely very helpful. You know, if I have like a problem or a question, I can just text her and she's always answers. But yeah, I just feel like our support system isn't as great as it could be right now. So, you know, parents are overwhelmed, especially in the current situation that we have now. Parents are under a lot of pressure. They spend half of their time either navigating the medical system or either for supports or services. So these support and emotional support systems are very important for them to be able to cope and be able to help their child and youth. And families themselves, you know, some parents do need that emotional support, do need that support or that guidance to be able to cope with all the challenges that a child or youth with special healthcare needs has. So it's important for these supports to be in place for families. Thank you.
And to tag the quote that Miriam read, that was one of our participants from one of our first group sessions. And the interesting sort of makeup of the session was 4 out of the 5 parents had children that were at least 10 years of age. And this individual had a child who I believe was right around the 2 or 3 age mark. So very new to having a child with special healthcare needs relative to the other participants. And throughout the session, you could hear the others talk about their supports, and this individual still felt very unsecure, felt very, you know, insecure, I should say, that she didn't have a lot of supports around her. And specifically, that speech therapist was one of the people that she mentioned over and over again that was continuously there for her. And it was really nice to see the rest of the group kind of pull her in by the end and say, you know, if you have any questions that aren't typically something you would send to your speech therapist, we're here for you. And to see those sort of emotional and social supports come up in such an impromptu and brief moment kind of highlights how much these parents need these connections to stay, you know, to stay feeling happy and secure. So thank you, Miriam. The next one is navigating education, and I'm going to turn this one over to Shaniqua.
Hi, again, my name is Shaniqua McKenzie, and I am the project administrator for the Einstein Regional Support System. Center. So the next topic we're going to talk about is navigating education. So we've defined navigating education it's more complicated for children and youth with special healthcare needs, because it can at times be difficult to make sure that your child's unique needs are being met. So the families express a wide variety of concerns. Placement concerns could be a disagreement with the school about the right placement or a lack of available placements. Family report advocating for more therapies or different kinds of therapies. Communication is key. This was one of the biggest areas that our parents would complain about, is the lack of communication between the parents and the schools. So building collaborative relationships between the school and the parents is critical to meeting the child's needs. With special education, it's like learning a new language, and we're often confused and overwhelmed during the transition periods. A lot of times the parents would feel like when speaking with staff at the school that they weren't even speaking the same language, because of course the parents are not familiar with certain terms. An example of existing supports: referrals to advocacy training in organizations that provide advocacy services. A lot of times the parents felt a lot of support in learning how to navigate early interventions. Parent suggestions: provide more support to parents with transitions to CPSE and CSE. Supporting school districts in understanding the range of available placement options. Also, to learn more about how the child's medical needs or diagnosis can be integrated into the school's district plans. I'm going to read one of the quotes that one of the families had to say. She did well for a couple of months, and then, it just became apparent that she really needed something more therapeutic. It was a process. It was a painful process of advocating for her to be able to get her in the correct program. And from what that parent says, we had many, many parents that felt the same way when trying to have their children put in a correct program that would help that specific child's needs. But thank you.
Thanks, Shaniqua. And I'll add to that. It's been interesting to hear kind of the struggles that parents have and the triumphs that they've had in the education system with their children. A lot of the frustration they recognize comes down to either teachers just not having the information at hand, or just not having the support that they need in order to maintain the environment that their child needs. So, as much as there's some, what's the right word, angst around education, sometimes there is recognition that it's not necessarily one person's fault. We need to be working on this on a large systemic sort of level. So thank you, Shaniqua, on that. And next, I'm going to go to transition, which I'm going to have Marcel talk about. And transition is kind of a broad word. We looked at it a lot in terms of the education system, but we also did do a little bit of overlap in terms of medical care. And that is one of those things that we'll address at a later date, is transition within the medical area for children as they grow up and become adults according to the system. So I'm going to have Marcel take transition from here, though.
Thank you, Mark. This is Marcel Pachter from Einstein Montefiore USET, and I would like to present the next topic about transition. Transition is the process students and their families use to think about life after high school, to identify their desired outcomes, and to plan their community and school experiences, to assure that the students acquire the knowledge and skills to achieve their goals. A truly successful transition process is the result of comprehensive team planning that is driven by the dreams, desires, and abilities of youth. A transition plan provides the basic structure for preparing an individual to live, work, and play in the community as fully and independently as possible. We have some examples based on what family expressed. They said it is complicated to prepare students when they have to move from the world of school to post-school activities, including post-secondary education, integrated employment, continuing and adult education, adult services, or independent living. Also, that there is no uniformity in terms of transition. Some districts have a full-time transition coordinator, others do not. And it falls on the parent to figure out transition services for their child with special healthcare needs. And here, right below, we include some suggestions we heard coming from parents. Let's see. Transition planning, opportunities and programs, transition services and requirements as authorized by IDEA, and the Rehabilitation Act, education and employment options for students and youth with disabilities after leaving secondary school, supporting decisions made by students and youth with special healthcare needs. Also, we added just at the right side of the slide in a very pretty pink color, 2 quotes coming from parents that Rochester had in some of their sessions, right? However, instead of reading them, and as Mark explained earlier, besides a family specialist for this project at the Einstein Montefiore USET, I'm a periodontist. My specialty is working with neurodevelopmental disability patients, but most important is that I am a parent, a single mom of 17 years old twins with very special healthcare needs. And with this, I would like to point out that my professional experience together with being a parent is showing empathy and totally understanding the difficulties parents have explained over our sessions related with transition services. Thank you.
Thanks so much, Marcel. And I think Marcel pointed out one of the things we've heard most frequently is kind of the inconsistency between different districts or different counties, where some have a lot of services or programs focused on transition and really prepare their youth for moving into the next stages of life, and there are several that just don't have anything out there. And bringing them together, hearing the 2 different sides of the story has been very, very interesting for us as an RSD and as a USED, and I'm sure Einstein has seen that as well in their interviews. Thank you so much, Marcel. So this is a moment where I'm going to give a brief pause and allow any questions that you may have about what we found so far from our family sessions, anything that I've presented on so far. Feel free to unmute yourself and just go ahead and ask. All right, well, I will take that bit of silence as we're ready to move on to the next section. And I want to introduce Wendy Douglas. She is here from Chautauqua County, and she is going to give us an introduction to Strong Start Chautauqua, which is a great initiative that they have pulled together with community partners in improving the health outcomes of mothers and children in their county. So take it away, Wendy. Thank you.
Hello, I'm Wendy Douglas from Chautauqua County. I'd like to share some information regarding Strong Start Chautauqua. The idea is to promote healthy starts for all Chautauqua County children and families through the universal screening, assessment, referral, and treatment. We had a group of people get together in the summer of 2018 for a 3-day Leadership Institute. And outside of the Leadership Institute came the mission to improve outcomes for all children with parental substance use that impacts the development of their families. And the vision was for all children aged birth to 5 in Chautauqua County are healthy and their families are informed, engaged, and supported through universal and uniform screening and linkage to needed resources. All expectant women will have access to prenatal and substance use education and substance use disorder support, and all children will have access to timely and responsible care that will allow them to achieve their full potential. And this is just an overview of the group of people that got together in 2018, and since that time we've grown to over 50 multidisciplinary partners from both Chautauqua and some from Erie County as well. And the reason we all got together was there's a notable issue going on in Chautauqua County, and then what we've noted is the number of children born affected by maternal substance use is more than 5 times higher than the state, is actually the highest of Western New York, right up there with Niagara County. And of course, since COVID, drug overdoses have tripled since March of 2020, and there's been an increase of 53% of the number of pregnant women testing positive for drugs at the time of delivery. And this doesn't even count the use of alcohol or tobacco. So we felt that the children in Chautauqua County are in a crisis, and they're in an extreme risk due to an alarming rate of maternal substance misuse during pregnancy. And this includes alcohol, tobacco, opiates, and other illicit and prescription drugs. And as you can see, it's a growing problem in our county. The rate of infants born affected by maternal drug use rose 300% over a 6-year period in Chautauqua County. For every 1 child born in New York State, we have 5.4 children born in Chautauqua County. In Chautauqua County, we have the highest opiate burden rate in New York State. And the Chautauqua County infant mortality rate is 6.3 per 1,000. In comparison to New York State is 4.6. We also have the 4th highest poverty rate in New York State, and Chautauqua County accounts for 10% of all allegations of parent drug or alcohol misuse, yet contains only 0.65% of the state population. So we have a high number of children born with substance misuse, but not a very large population. And this screen just kind of shows where we stand in comparison to the other Western New York counties. The only place that's a little statistically the same would be Niagara County. This is we took from our did a screen of what we're seeing in the children, the moms testing positive for at delivery from August of 2019 through July 15 of 2020. The drug of choice is marijuana, followed by meth. We do have quite a few women both put on Subutex for treatment, but also many that are using it illegally, followed by cocaine, heroin, other opiates, meth, and speed and methadone. The environments we create and the experiences we provide for the young children and families affect the developing brain and in turn all the other systems. This is just a picture from Harvard just showing the different, how drug misuse will affect the newborn and the child. So this unkind environment and from the impact of maternal substance misuse leads to low birth rate, problems with the heart, kidneys, and other organs, damage to parts of the brain, which can often lead to behavioral and intellectual disabilities, learning disabilities with a low IQ, hyperactivity, difficulty with attention, poor ability to communicate in social situations, poor reasoning and judgment skills, and this can lead to lifelong issues with school, social skills, living independently, mental health, substance use, keeping a job, and trouble with the law. So with all this in mind, we wanted to try to figure out a way to intervene. Under the direction of Dr. Ira Chesnoff and his upstream, NTI Upstream program, we are developing what we call a SART solution, which is universal screening, assessment, referral, and treatment for all children born in Chautauqua County. Back to the screen, I should have said. Reduction in rates of fetal death, preterm delivery, and low birth weight, and NICU stays. Family stability, fewer child abuse and maltreatment cases, early detection of delays and disabilities. Connection with early interventions prior to school entry, improved child mental health, greater school and life success, nearly 8 million in annual savings associated with fewer low birth weight babies in the county, and about 17 million in special education savings per year. This is what we're hoping to move towards as we build our system. And this is statistics that UTI Upstream has already published. This is an example of where we want to be someday. At this point, we have begun our pilot as of October 1, and it will run through December 31st of 2021. We have started with universal screening of all pregnant women in both our birth hospitals and in all OBs in the county. All children born are screened with an ASQ, ASQ-SE. We were using what's called the red flags. We have changed that to child form A. When we mention doing red flags, it kind of upsets parents. So we're trying to make this as friendly as possible. The idea is with this screening, we will then work with either the mom and or child or who's ever caring for that child. We have a number of children in foster care being raised by grandparents, so that we can develop a plan of care through our navigation. Our family navigation is under the direction of the positive direction model of Dr. King, and it's being done through the Mental Health Association. So they will have a peer person that has lived this life of substance abuse, and they will help navigate these parents and the children, as we will track the children and move them forward too. At this point, we started universal screening. We've started to bring the programs together. We're doing right now an assessment of all the programs that are out there, and eventually we will have this multidisciplinary team meeting that will focus around the child with those that are working with the child. So this is just the outline of the program that we're developing. The idea is building resiliency. By building resiliency, we're going to offset adversity. Our objectives are to reduce the stigma and increase community support for substance misuse prevention, treatment, and recovery programs, universal maternal substance use screening and improved pathways to support, universal infant child development screening and child form A, screening in the cross sectors, improved pathways to early intervention services for family and support, improve a culture and gender relevant prevention, intervention, navigation, treatment, and recovery system using the positive direction model from Dr. King, increase the percentage of countywide OBGYN and child health care providers making referrals to services to prevent and migrate the effects of substance misuse. And we're going to implement a cross-section of communications, referral, and follow-up platform, a community information exchange for the C-STAR program. This is the example of the leadership group, or the different groups that are working to promote the beginning of the pilot. So you have a perinatal, prenatal work group, you have a child age work group, we have community work groups that are targeting the physicians and the school systems. And then we have the task exchange, information task work group, which will be eventually putting everything together through a computerized database. So our goal is to eventually have a transdisciplinary team, which will have providers, mental health providers, OBGYNs, child and family health care providers, mothers in the treatment and children in treatment, and of course their families, early intervention providers, and other partners as appropriate. If there's any questions, you can give me a call at area code 716-753-4819. And I thank you for listening.
So that moves us into another Q&A. So if anybody has any questions for me at this point, any of our family specialists or Wendy from Chautauqua, now is the chance. Feel free to unmute yourself and just ask. I'll take that silence as a good thing. We'll continue to call it golden silence. If anybody has any questions after, I just want to thank you for joining us today for our networking meeting for the local health departments. I hope you got something out of it. We will do another presentation in the coming months once we have more data pulled together from the needs assessment from you all. As we continue to do our family focus groups, individual and group sessions, we will make sure we apprise you of that information as it comes. We'll hopefully have Wendy back next year and talk more about Strong Start Chautauqua. But again, thank you for joining us. If you have any questions, feel free to email any of us with those questions.